I'm Dr. Mia Carter, and you're watching True Wellness Network. If you're an adult man who genuinely wants to understand women's pleasure better, not through myths, not through aggressive advice online, but through calm, respectful, medically grounded understanding, this video is for you. What most men are never taught is that female pleasure is not about force, speed, or copying what you've seen elsewhere. It's about timing, communication, blood flow, nervous system safety, and consistency. When those things come together, intimacy becomes deeply satisfying for both partners. Before we talk about technique, we need to address something more important than hands or movement: mindset. A woman's arousal is not a mechanical switch. It is a full body and brain-driven process. Stress, feeling rushed, fear of judgment, or lack of emotional safety can shut down arousal even if physical stimulation is present. When a woman feels respected, unrushed, and emotionally secure, her body responds with increased blood flow, sensitivity, and natural lubrication. This is basic physiology, not opinion. One of the biggest mistakes men make is starting too fast, too directly, and too intensely. Anticipation is not a delay. It is the engine. Gentle buildup increases circulation to the pelvic region and heightens nerve sensitivity. This is why slow, indirect touch before direct stimulation leads to stronger sensations later. When men skip this phase, they often mistake a lack of response for disinterest, when in reality, the body simply hasn't had time to warm up. Another essential foundation is communication. Clear, respectful consent is not awkward. It is attractive and calming to the nervous system. Simple questions like, "Does this feel good?" or "Would you like more or less pressure?" allow a woman's body to stay relaxed instead of guarded. From a medical standpoint, relaxed pelvic muscles allow for greater comfort and sensation. Silence and guessing often create tension, which reduces pleasure. Preparation also matters more than most people realize. Clean hands, short, smooth nails, and the use of a gentle, unscented lubricant if needed are not optional details. They are part of safety and comfort. Friction can cause micro-irritation that interrupts pleasure and creates discomfort later. When the body feels safe, the brain allows pleasure to deepen. When touch begins, external stimulation should always come first. The outer pelvic region has thousands of nerve endings designed to respond gradually. Light, slow contact allows the nervous system to interpret touch as safe rather than overwhelming. Many women experience direct stimulation as uncomfortable if it happens too early. Think of touch as an invitation, not a demand. Rhythm is far more important than intensity. Research and clinical observation show that consistent, predictable patterns are processed by the brain as pleasurable, while random pressure can feel distracting. Once a rhythm is found that a woman's body responds to, maintaining that rhythm is often more effective than constantly changing techniques. This is one of the most overlooked principles of intimacy. As arousal builds, the body gives clear signals. Breathing patterns change, muscles soften, subtle movements appear. These are signs that blood flow and sensitivity are increasing. This is the point where many men make another mistake. They suddenly change speed or pressure. Consistency at this stage allows pleasure to rise naturally instead of resetting the body's response. Internal touch, when desired and welcomed, should always be slow and mindful. From a medical perspective, the vaginal canal is responsive to angle and pressure rather than rapid movement. Gentle, controlled motion allows the pelvic floor muscles to stay relaxed. If tension appears, returning to external touch helps the body recalibrate. There is no rush. The nervous system needs time to interpret stimulation as safe and enjoyable. There is an area along the front internal wall that becomes more responsive with arousal. Sensitivity here increases gradually, not instantly. Light, steady contact is often more effective than deep or forceful pressure. Many women respond best when internal and external stimulation are coordinated, but this varies by individual. There is no universal formula. Attention and listening matter more than technique. As arousal approaches its peak, the body becomes extremely sensitive to changes. This is why stability is crucial. When something clearly feels good, maintaining the same pressure and rhythm allows the nervous system to follow through. Sudden changes at this moment can interrupt the response. From a neurological standpoint, the brain is completing a pattern. Consistency allows completion. After intense sensation, the body needs reassurance. Gentle contact, holding, or calm touch helps the nervous system transition out of heightened arousal. This phase is often ignored, yet it plays a major role in how the experience is remembered. Positive aftercare strengthens emotional connection and trust, which directly affects future intimacy. There are also important hygiene and safety considerations. Switching between different types of contact without cleaning can introduce bacteria and cause irritation. Pain or burning is never something to push through. Discomfort is the body's way of asking for adjustment, not endurance. Respecting these signals builds long-term comfort and confidence. One truth that needs to be said clearly is that not all women experience pleasure in the same way. Some respond more to external stimulation, others to combined sensations, and some do not reach climax through internal stimulation at all. All of these responses are normal. The goal is not performance, it is connection and mutual enjoyment. From a health perspective, emotional safety directly impacts physical response. When a woman feels admired rather than evaluated, unrushed rather than pressured, her body produces more natural lubrication, increased blood flow, and greater sensitivity. This is why patience is not just kindness, it is effective. For men, confidence grows when intimacy becomes less about guessing and more about listening. Your hands are not just tools, they are instruments of communication. When used with care, awareness, and consistency, they can create experiences that feel deeply satisfying and respectful for both partners. If this kind of medically grounded, respectful guidance is valuable to you, subscribe to True Wellness Network. Our goal is to replace confusion and misinformation with calm, evidence-based understanding. Real intimacy is not about tricks, it is about awareness, patience, and presence. For men who also want to support their own performance and circulation, certain natural nutrients have been studied for their role in blood flow and vitality. Compounds that support nitric oxide production and hormonal balance may help overall confidence and stamina. You'll find educational resources linked in the description. I'm Dr. Mia Carter, and this is True Wellness Network. When intimacy is approached with respect, clarity, and care, it becomes something powerful. Not just physically, but emotionally as well.